stand and start with the Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the July 13, 2015 meeting for the Shawnee County Board of County Commissioners. My name is Kevin Cook, serve as the chair, also representing District 2. Joining me this morning is Commissioner Shelley Bueller, representing District 1.
Good morning.
Commissioner Bob Archer, representing District 3. Good morning.
Good morning.
Madam Clerk, if we could start with the first item.
Is there an item to be
Oh,
added?
thank you. There is an item to be added. I understand that the health agency, due to a timing issue on a contract, needed to have an item added. This would be added as item C4, and it is consider authorization and execution of contract 264-2015 for additional funding with the Kansas Department of Health and Environment in the amount of $54,170 to provide equipment, training, and education on Ebola and other highly contagious diseases. And that would be a motion to add that item.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. All opposed? Passes 3-0. Now we're ready for the first.
Unfinished business, number 1, consider authorization and execution of contract C-259-2015 with Westlaw for online legal research access for 2 years for the Counselor's Office, the Sheriff's Office, and the Department of Corrections, with a 3% increase in year 1 and an additional 3% increase in year 2 from the current rate of $1,043.41 per month.
Good morning, Commissioners. Rich Eckert, Shawnee County. This is back on again. You had asked us to check with the District Attorney, and this is what we found out. They're on a 3-year term, and their term will end December 2017. So when I'm done with this presentation, I want to ask you to sync our 2 contracts up. They have 25 users on their account, and they pay $2,486 a month. Now, as Commissioner Cook was talking about with how you use the databases, they do use different databases than we do. Ours are research-based. We're always trying to find the newest case or a case that'll help us. And they do some of that also, but they also they pay an extra $265 a month for something they call Clear Plus Web Analytics that their investigators use. And then their databases focus more upon pleadings like appellate court briefs, civil pleadings, motions, memos, national reporter images that are unique to district attorneys. So with that being said, though, there's no reason that we can't sync the contracts up and start negotiations with Westlaw when that time comes. So what I would ask for you to do today is to give us authority to enter into the contract as we've presented at that price. Westlaw told us that they would carry that price through the extra months that we would need, so we're going to get an extra 5 or 6 months here and sync these 2 contracts up, and then we'll start negotiating them in mid-2017.
Any discussion? Commissioner Bueller?
No, I have no questions. Thank you.
Commissioner Archer?
No, thanks for the research. It's appreciated.
Rich, can we have that put on with the audit finance? So I know that they have the calendar tickler for contracts, and so that way we make sure that, you know, in 2017 we're all fresh with that issue.
Sure.
I'll make a motion to approve the contract with Westlaw.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. All opposed? Passes 3-0. Thank you very much. Next item.
Item 3, consent agenda.
Are there any questions or comments regarding the consent agenda?
Motion to approve the consent agenda as presented.
I second.
Motion made by Commissioner Archer to approve the consent agenda as presented, seconded by Commissioner Bueller. All in favor say aye. All opposed? That item passes 3-0. Next item.
Item 4, new business. A, County Clerk. Number 1, consider all voucher payments.
Of the larger amounts in the vouchers, detention facility with Horizon Health is $167,615.13. Health insurance, $76,458.76. And Parks and Recreation, $40,338.62. That brings the total of vouchers to $524,321.65. And I have no questions. Move approval.
Motion made by Commissioner Bueller for approval of the vouchers as presented.
Second.
Seconded by Commissioner Archer. All in favor say aye. All opposed? passes 3-0. Next item.
Number 2, consider correction orders.
I'll make a motion to approve the correction orders.
Second.
Motion made by Commissioner Cook, seconded by Commissioner Archer. All in favor say aye. All opposed, it passes 3-0. Next item.
Item B, Sheriff's Office, number 1, consider authorization and execution of contract C-262, 2015 with the City of Topeka for the Code Red system, which is a web-based emergency notification system at a cost of $11,000 for the period July 25th, 2015 through July 24th, 2017.
Morning, Commissioners. Lance Royer with the Sheriff's Office. This is a 2-year contract. The city pays half of it. We pay the other half. We use this for notification of citizens of crimes in the area or flooding or anything like that. One extra little step, we are branching out. Emergency management is also going to use this for weather notifications. Citizens can sign up either on the City of Topeka Police Department website or our website to get notifications from their cell phones or email or anything like that if they'd like to. We've got about 60,000 subscribers using this system today. So.
Any questions regarding this contract?
I don't have
Commissioner
any
Bueller?
questions, just a comment. It's an invaluable tool, I believe, especially during flooding. It acts basically as a reverse 911, correct?
Correct, absolutely.
And gets the information out to a large amount of people, and you can target it into certain areas, correct? So,
Just want to make you aware, the Homeland Security Council did purchase a notification system like this called Everbridge. It's free for the region. The problem is the region only bought 30,000 subscribers for 21 counties. Obviously, as I said before, ours has 60,000. So we're going to use that as well. The rural fire departments, the police department, and us and the Topeka Fire Department are going to use that for actually employee notification to notify employees of different things. So, but this one is what we'll use to notify the public in emergencies and crime in the area.
great.
Is this maintained by the City of Topeka and operated by the City of Topeka, or do we have any say in its operation?
We have users that can use the system. Emergency management will have users that can use the system, and Topeka Police Department has users that can use the system. So all 3 of us have users. They are the administrators of the system for Shawnee County.
Okay, so they set up the parameters and how it's maintained and utilized.
I guess that's a fair statement. I mean, we can set up who we want to notify and how we notify them. They just manage the contract, basically.
All right. Is there a motion regarding this contract?
I'll move approval of the contract.
Motion made by Commissioner Bueller for approval of the contract.
Second.
Seconded by Commissioner Archer. All in favor say aye. All opposed. Contract's approved 3-0.
Thank you, Commissioner.
Thank you. Next item.
Item C, Health Agency, number 1, consider authorization and execution of contract C-263, 2015 with Coleman Associates for a workshop previously approved, but adding an additional training day for a new cost of $13,680, which is an increase of $4,420 from the previously approved amount of $9,260 and covered by grant funding.
I have just realized an error on my memo, so I do want to clarify that it's not to add a 3rd training day, it's to add a 3rd trainer. So just to make sure that we're clear, the training will still consist of 1 day on August 26th, but instead of having 2 trainers, there will be 1 trainer flying in. So just to clarify, we did have grant funds awarded to us for the purposes of addressing continued quality improvement within the clinic setting. We have looked at some of our funds that we were going to use for other training and have decided it would be best to reallocate it to this training so we can work in smaller groups and let those clinical teams work more closely together. And so that's why we've adjusted this particular day and are looking to use more funds for this training. So I'd be happy to answer any other questions.
Questions regarding this item? Commissioner Archer?
I haven't really had an opportunity to review this as carefully as I'd like to. Can I make a motion to defer consideration of this contract until Thursday? That's not going to cause a problem since the training's not until the end of August.
Right, and just to note, this is something that had been previously approved, and all we're doing is adjusting so that we can make it more meaningful for the people that are participating.
Okay, I'd just like to review it more carefully if I could.
There's been a motion made by Commissioner Archer to defer this until Thursday, and I'll second. And again, I don't know that this will delay this will not delay the timing of the,
It won't delay, it will not delay the timing of the training, but I know that the folks that are setting up the training just want to assure that they have the commitment from our end that we're going to pay the cost of this training.
so this item will be motion made by Commissioner Archer to defer till Thursday, seconded by Commissioner Cook. Commissioner Bueller, any other? Okay. All in favor, say aye. All opposed. This item will be taken up on Thursday, the 16th. Next item.
Number 2, consider approval of request to submit an electronic application to Health Resources Services Administration for expanded medical services FY 2015 supplemental funding in an amount of $238,630.
Good morning, Commissioners. Again, Alice Weingartner, Health Agency. Periodically, federally qualified health centers around the United States are informed of opportunities for additional funding to help address the needs in their community. An expanded services supplemental funding announcement was released late in June, and because of the formula that they have in place, Shawnee County is eligible for the $238,630. The expectation of those fundings is to support the increased access to comprehensive care, such as primary care. That could be enabling services. It could be medical services, oral health, all of those types of things. We believe, and when I say we, I've had conversations with the Community Health Center Board as well as Safety Net Clinic partners, that it's important for the community to apply for this funding, mainly because this funding is something that we would then put forth in our successor of interest application as funds that would continue once the operational change of the Community Health Center takes place. Some of the things that we're looking at for use of these funds include the purchasing of vaccine refrigerators so that they can be on site in the primary care clinic locations. Historically, we have not had those, but in order to ensure the safety of those vaccines, we want to make sure that we have them available. We are also been approached by one of our community partners about the idea of sharing the cost of a physician, and so rather than having to figure out how we could cover that cost within our budget already, this would just be those funds that would be in addition to that would help us cover the costs for sharing that physician. And then we would look possibly at some current staff we have who are at 0.5 full-time equivalent and maybe increasing their hours to help cover some of the support services in the clinic. One of the discussion points within the Community Health Center Board meeting last week was, could we also use this time and possibly this new provider position for looking at how we expand hours of services? And that's something that has been a point of discussion within the Safety Net Clinic groups as well. So as noted in the memo, accepting this award does not require any county tax support. It does not require any match. And this would be additional funding that would continue to be available to the Community Health Center in subsequent years based on available funding. So I'd be happy to answer any questions.
Questions regarding this item? I'll make a motion to approve the application with the Health Resources Services Administration.
I'll second.
Motion made by Commissioner Cook, seconded by Commissioner Bueller. All in favor, say aye. All opposed, passes 3-0.
Thank
Next
you.
item.
Number 3, consider approval of request to utilize a temporary staffing agency to fill an RN position at a revised cost of $50.95 per hour due to an increase in the state contract rate.
Good morning, Commissioners. Again, previously you had approved the use of a temp agency through Cascade Services for filling one of our nurse positions with a temporary nurse RN. The rate has increased to $50.95 per hour. They had gone through some contract negotiation that we were not aware of at the time, and I have had a conversation with them, and they have stated that the nurse that they have is pretty strong in keeping this rate. So again, the nurse doesn't get that whole rate, but this company is also facing the same challenges many of us are in hiring nurses because of so few being available. So I do ask for your approval at this new rate. I did talk with Jim Crowell, who I believe is here as well, if you have any other questions. And I hope that you'll support this request because right now we are at a deficit in RNs in the clinic. And so in order to help relieve some of the stress on our system, it would be really helpful to be able to fill this position. Thank you.
Questions regarding this request?
Move approval of the request.
There's a motion made by Commissioner Bueller for approval of the request. I will second. All in favor say aye. All opposed? That item passes 3-0.
Thank you very much.
Next item.
Number 4, consider Kansas Department of Health and Environment Ebola supplemental funding.
Good morning, Commissioners. Allison Alejos, Health Agency. First, I apologize for being late, but thank you so much for adding to this to the agenda. It got away from us last week, and so we just wanted to be able to get this grant submitted. This is actually a request for Ebola supplemental funding. It is coming from the Center for Disease Control through Kansas Department of Health and Environment. It's a grant that we can have for $54,170, and this would allow us to increase and enhance our current preparedness responsibilities as it relates to contagious diseases, things such as Ebola. Some of the things, the expectations from this would be that we would participate in a tabletop exercise that's specific to Ebola preparedness and our response. We would also be able to buy personal protective equipment with these dollars. We would also be expected to participate in trainings that are put on by Kansas Department of Health and Environment and on topics such as cleaning and disinfecting the workspace, also risk communication training, things of that nature, just really to help us be able to increase our capacity, not only for the health agency, but others in the community.
Questions regarding this item? Commissioner Archer.
How many cases of Ebola are in the state of Kansas now?
0.
How many cases of Ebola are in the Midwest?
0.
How many cases of Ebola are in the United States?
To my knowledge, they've all been treated at this point. We do, however, have cases, people that we are monitoring for Ebola in the community. We're not anymore, but not only here, but throughout the rest of the state, folks that are coming back from high-risk areas. So it continues to be something that we need to prepare for. And even if it's not Ebola, other highly infectious diseases are something that we as a community are responsible as a county to take care of.
So I guess it's a solution looking for a problem.
I think it's an opportunity for us to be able to enhance the training that our staff have and to be able to be prepared in the event that we should get something in our community.
Not to be flippant, but if this memorandum said zombie preparedness, it would have the same impact, wouldn't it? I mean, it's preparing for a contagious disease and how the community would respond to it.
Correct. We are, and that is something that we are required to do as a county to provide surveillance and containment activities, and that's something that we do at the county along with our regional partners in the area.
So my question on it is, what additional benefit does Shawnee County have that we are not already doing?
Well, for one, the personal protective equipment that we have, the level of that is much higher than we're used to dealing with. That is something that we have seen. There's a variety of tiers that we have to participate in, and that's, I could name the equipment if you want me to do that, but whether it's as simple as a mask and gloves, or if it's a PAPR system so that you're getting respiratory protection in an enclosed environment. It could be that, it could be any number of things, and it's going to change, and our folks have not had the training in this because we typically don't see these highly infectious diseases in our community. So it is an opportunity for our staff to become better able to respond to these should they happen. At this point in our community and across the U.S., everything's just a plain right away. So while it may not be here today, who knows what could happen in the future.
Commissioner Bueller, do you have questions?
Move approval of the request.
There's been a motion made by Commissioner Bueller for approval of the request. I'm going to second, but I want to clarify, my second isn't as to Ebola. I think that if we were looking at Ebola, that is but the name that's placed upon this. I think that if I'm seconding it for the contagious diseases and preparedness for contagious diseases,
Certainly.
which your office is tasked by statute to prepare for.
Correct.
So that is my second. Any other discussion?
Well, and the argument could be made that it's a grant, but it's still tax dollars and somebody's paying for it, and I'm going to vote no.
Okay. So Motion made by Commissioner Mueller, seconded by Commissioner Cook. All in favor say aye. All opposed?
No.
Motion passes 2 to 1.
Thank you.
Next item.
Item D, Commission Number 1, consider appointment of Kevin Garner to the Jayhawk Area Agency on Aging Board of Directors.
This is a request that has been made to the commission for Mr. Garner to come to, come to the Jayhawk Area Aging. Is there any motions, discussion?
Move approval.
Second.
Motion made by Commissioner Bueller for approval, seconded by Commissioner Archer. All in favor say aye. All opposed? Passes 3 to 0. Next item.
Administrative Communications.
Is there any administrative communications this morning?
Good morning, Commissioners. Randy Luby, Parks and Recreation. Just wanted to remind you, tonight is the Shawnee County Baseball Hall of Fame inductee. We have several special individuals and an organization going into this year's Hall of Fame. We have Steve Anson, the longtime Washburn winningest coach in their baseball history. We have Gil Carter, who unofficially has hit the longest home run in pro baseball. Dick Cooley is a major league player in the late 1800s. We have official John Big Dog Dietrich, as he goes by, well-known official for the Shawnee County area. Bob Henson, the longtime Capital Journal sports writer. Mike Burton is receiving the first annual Beanie Conwell Award, which goes to an individual that goes beyond the call of duty and volunteers a lot of time for the youth of baseball in Shawnee County. And we're really special tonight to have the Highland Park Baseball Association for 75 years of continuous youth baseball in Shawnee County. That's quite a special award, and I just wanted to remind the public and yourself that starts tonight at 5:30, the social half hour or so, and then the ceremony and dinner is at 6. Also this week, we are proud to host the 2015 USSSA C National Championship for the 14, 16, and 18 under girls. Activities start on Wednesday, and we have our opening ceremonies at TPAC at 7 p.m., and I believe Commissioner Cook is going to do the welcoming to that. The games start on Thursday. I just talked with Brian. We're up to about, I think, 54 teams, and this will have an economic impact of about $1 million to Topeka and Shawnee County for this week. I would like to take time to thank Visit Topeka as well as Parish Hotels also for this. So, busy week.
Yeah, absolutely.
Thank you.
Other administrative communications. Commissioner Bueller?
I don't think I have anything. Thank you.
Commissioner Archer?
Oh, and just real quickly, Mr. Chair, I had an opportunity to attend an event at the zoo on Saturday evening, and I think we just take for granted how nice Gage Park is, and the pool, and the people were there. The pool was busy, and the zoo was just magnificent. And I think we overlooked that gym in our community. It is quite an event and quite a beautiful space. So that's it. Thank you, Mr. Chair.
I couldn't agree with you more. Those are great opportunities for us to really connect parks and recreation all in one. Often we think of those as being independent of each other, but those are really two items that go well together. I might note that this is the start of Fiesta. There is a opening tonight, and I would encourage everybody to take a moment, go down to Oakland and participate. It's always a great community event. We also we'll be leaving here in just a little bit to go to the Expo Center to welcome the World Horseshoe Tournament to Topeka. So the Mayor Wolgass will be throwing out the first shoe with the other mayor and from the first World Horseshoe Tournament. And so we look forward to welcoming all the horseshoe participants in the Topeka and Shawnee County community. So,
Mr. Chairman, I might add that we do have a JADO meeting at 6 o'clock on Wednesday evening as well.
yeah, absolutely.
Busy week.
So
Are you throwing out a shoe or something else, Commissioner?
I think I get to participate by being there. So,
Okay.
my athletic prowess, they heard far and wide, and they didn't want me competing with the mayor. So, with that, next item.
Executive sessions.
I do not see a need for an executive session. We are adjourned.
What time's your?
Welcome. 9.